how do you get someone in their 30s or 40s to care about those bone density implications later on in life? It's difficult, isn't it?
It's so hard because there's a temporal disconnect. There's this banking idea. I learned it from my bankers that they experience called temporal disconnect. On average, they cannot get the average person to save $10 for their pension, right? It's the same in health. I cannot get people motivated in their youth for their old age. So for the women and men in the critical decade, which I call 35 to 45.
I love that. Is it just for women, though, or is it for men as well?
No, it's for men. It is time to get your proverbial health standards in check. Because if you build a lifestyle where you're eating a non-inflammatory, high-protein diet so that you're able to build, or if you're eating at all, many women decide not to eat enough. We can talk about that. If you've got your food down, and it doesn't mean you can't live and have an occasional, you know what, I had a piece of chocolate before I walked in here. I'm not talking about austerity. The standards of nutrition, a muscle building practice, a cardiovascular building practice, it's a lifestyle to you. It is not a burden if that's just the way you live. The critical decade is the time to get that in order before you lose your hormones, right? For women, once you hit your mid-40s, now you're adding that burden that we already discussed.
Yeah, it's almost as if we can kind of get away with things until our mid-30s, right?
That's right.
So, yeah, there are health-promoting things to do, but even if you don't do them,
you'll skim by.
You still seem to get by, or a lot of us do in our 20s and early 30s. Yeah. But then there does tend to come a point in most people's lives where it's like, well, wait a minute. If I don't pay attention to this, there are consequences.